Hi, everyone. And thank you, Sarah, for that introduction, and thank you to the CBRC for having me. So today this presentation is going to be on differences in reported sexually transmitted and bloodborne infection testing barriers among gay, bi, queer, and other men who have sex with men, cis and trans, and two-spirit people using GetCheckedOnline in BC. So GetCheckedOnline is an online-based program for testing for sexually transmitted and bloodborne infections, or STBBIs. It is run by the BC Centre for Disease Control, and it is integrated into existing clinical services. So it's seen as a sort of virtual clinic that is a complement to services that exist and to fill potential gaps that might be existing in in-person services. The objectives of GetCheckedOnline are to increase uptake and frequency of testing, to diagnose infections earlier, to reach populations with higher rates of STBBIs and that face multiple barriers to accessing testing, and to increase clinic capacity and improve use of clinician resources. So if you're wondering how it works, first you go to the website, getcheckedonline.com, and you can create an account. And then when you want to get tested, you have to complete an online risk assessment questionnaire, and that will create a test requisition form. And you can print that out or bring that on a mobile device directly to a lab and for submission of specimens. And then you will get a notification when your results are ready, any negative results you can see on your account, and any indeterminate or positive results that you'll be contacted by one of the public health nurses. And then ideally this will engage folks in repeat testing. So after numerous years of formative research, the program was piloted in Vancouver in 2014. So we just had our 5-year anniversary, go us. And the promotion was really to clinic clients that had to be turned away due to clinic capacity, and specifically to gay, bisexual, and other men who have sex with men, with the support of community partners such as him. You can see one of the ads that we had that we were running through him. And then after 2 years, with support from local health authorities, we had an expansion phase where we expanded the services to communities in island and interior health in February 2016, and this promotion was more broadly to the general communities. So we wanted to know if GetCheckedOnline was actually addressing some of the barriers that we imagined communities to be facing. And so this is data from a survey that was done simultaneously among GetCheckedOnline clients and in STI clinic clients in Vancouver in 2015-16. To see what differences might exist in people accessing those different services. And we found that GetCheckedOnline does address key barriers to testing. So if you can't see the image, the lower darker blue is GCO clients, and the lighter blue is clinic clients. And we compared to clinic clients, GCO testers expressed more embarrassment getting tested, discomfort talking to providers about sexual health, and fear of judgment. They also expressed more barriers related to access, such as wait times for appointments or traveling to clinics, and more delayed testing in the past year for any reason. So we know that GetCheckedOnline is addressing these barriers compared to in-person services, but we wanted to see how this might differ across all of the different implementation sites across BC. And we know that there are differences in availability of services across the provinces. So we asked the question, do barriers to testing for STBBIs for queer men, queer users of GetCheckedOnline, do they differ for folks in Vancouver versus outside of Vancouver? And that map is basically showing where GetCheckedOnline is currently available. So Kamloops and Nelson in the interior, and Duncan and Victoria and Langford on the island. So to assess these barriers, we used a multi-level framework that looked at different factors and barriers at different levels that might be related to testing facilitators of barriers. So we looked at individual level factors such as a personal empowerment in testing or personal testing history or reason for testing. We looked at the level of interaction between individual and healthcare providers, so possibly delaying testing in the past due to privacy concerns or comfort discussing your sexual health with your healthcare provider. We assessed possible barriers related to the clinics themselves, so maybe delayed testing related to access issues or distance. And then we looked more broadly at social and structural factors, such as stigma or embarrassment related to testing. So we assessed these by doing an online survey that assessed all of these the multi-level framework, and we had ongoing recruitment among GCO users from June 2015 to March earlier this year. And to participate, you had to have completed testing at least once through GetCheckedOnline, be at least 15 years old, and have consented to be contacted for research. So the following results that I'll show are bivariate analyses that we did of this survey data, comparing Vancouver to anyone outside of Vancouver, recognizing that this is a very crude kind of distinction of respondents, but Vancouver is still like the largest city in BC, and we want to see if there would be differences just outside of Vancouver. So of 943 completed surveys, 307 were completed by gay, bi, trans, queer, and two-spirit men. 171, or 56%, were from Vancouver, and 136, or 44%, were from outside Vancouver. You can see the various variables in the first column, and then the two right columns, you have Vancouver and then outside Vancouver. And anything that is bolded, the numbers that are bolded, those are statistically significant differences at p less than 0.01. So we see the median age in Vancouver, among Vancouver respondents, was 36 versus 33 outside Vancouver. Significantly more people in Vancouver identified as gay and had an income of at least $80,000. And we also see a difference in the proportion that identified as white, with less respondents in Vancouver identifying as white, although that wasn't statistically significant. So this table identifies all of the individual level factors that may differ among respondents based off of location. So we see that more people from outside Vancouver reported testing for the first time through GetCheckedOnline. There were no differences in other individual level factors. So testing as a routine practice, although not statistically significant, it was slightly higher in Vancouver. And a similar proportion were testing for a new relationship or because they had symptoms or contact to an STI or contact to STIs or HIV, both the similar proportions in Vancouver and outside Vancouver. And then we see in terms of personal empowerment to test, so we asked people if they agreed that testing is one way I can take charge of my sexual health, and we see across the board a high level of empowerment for respondents of the survey, which is unsurprising because we're asking people who have tested already through GetCheckedOnline. We also asked about interactions with healthcare providers, and there weren't any statistically significant differences, but there are some differences in magnitude I thought worth highlighting. So we saw a higher proportion of Vancouver respondents saying they were comfortable discussing sexual history with any healthcare provider, whereas outside Vancouver, more respondents said that they were worried about judgment from healthcare providers when providing sexual history, that they had delayed testing in the past due to a privacy concern, and that anonymous testing was important, and a higher proportion in Vancouver said that they were out to their healthcare provider. So in terms of clinic-related factors, if you just look at the white part, we asked about reasons for having delayed testing. We see that Vancouver respondents reported higher levels of delaying testing due to long wait times compared to respondents outside Vancouver. And we see similar proportions reporting delaying testing due to distance, needing an appointment, or knowing where to go. When we isolated just to people who had tested previously and asked about their last time testing at the clinic, we saw a significant difference with higher proportions of Vancouver respondents saying that they had to wait a long time to see a doctor or nurse compared to people outside of Vancouver, but similar proportions saying that they felt uncomfortable in the waiting room or felt comfortable using their real name to test. And so when we look more broadly at social and possible structural factors, there's a similar proportion within Vancouver and outside Vancouver that said it was embarrassing for me to test for an STI or HIV, about 1 in 10. But we see a significant difference in people who agreed that I would feel ashamed if someone I knew found out I tested for an STI or HIV, and that being higher outside of Vancouver. And we asked if participants agreed that I would feel guilty if I were diagnosed with an STI or HIV, and almost half the sample in Vancouver had agreed with that, and even higher percentage, almost 2/3, had agreed with that outside of Vancouver. In terms of social norms, we asked, among my peers, people regularly get tested for an STI or HIV, and we see that that social norm is reported among 3/4 of Vancouver respondents, and that's significantly lower outside of Vancouver. So in terms of some key differences, we see in Vancouver, in the demographics, we saw more gay identifying people and people with higher incomes, but we also saw that there were long wait times to see a doctor or nurse, and that people in Vancouver had delayed testing because of long wait times, whereas outside Vancouver, we saw more first-time testers on GetCheckedOnline. We saw more stigma associated with getting tested and less regular testing among peers. For all those non-significant differences, it might suggest that testing barriers and facilitators could be more universal than region-specific. Some of the limitations of this was an opt-in online survey for people who already completed testing through GetCheckedOnline. That's kind of why we saw that high level of personal empowerment in testing. We also saw that it was one time point, so we couldn't assess any changes or changes over time, so how empowerment affects actual practice in testing. Differences in testing histories might affect experiences and possible barriers faced in the past, and someone testing for the first time may have a different experience of barriers compared to someone testing for the 10th time. And a lot of respondents from outside Vancouver were from Victoria, so there is a more nuanced analysis to be done looking at different types of environments and region-specific variables, or even categorizing according to urban, suburban, or rural environments to look at what kind of relationships are there. And lastly, further research is needed among people who have never tested or completed testing through GetCheckedOnline. So it's possible that someone may have created an account but never actually gone on to testing. And it's also to look at people who can't access through GetCheckedOnline because of barriers, possibly such as access. So just some key points of conclusion. GCO addresses some key STBBI testing barriers for GBT2Q men that are both region-specific and experienced broadly. So differences in reported testing barriers may reflect regional opportunities for testing and service promotion. So outside of Vancouver, maybe focusing more on social norms or stigma related to testing, whereas in Vancouver, really focusing on addressing those long wait times in clinics. So I just want to acknowledge that this is a labor of love of many different people and partners from across BC, and great thanks to the BC Public Health Labs for the support in our work. And thank you.